It is a big burden, and it takes a lot of time to navigate through all this. It gets kind of crazy because you're looking at this massive kind of matrix, and you're trying to find a way to understand, really what is your maximum out-of-pocket going to be, and the co-insurance and that kind of puzzle. I had to work through all these different choices, and that's really challenging. I don't know if you've ever done it, but I think there was some frustration over sometimes the plans look so similar.
Once the whole Affordable Care Act went into effect, I had to switch from the PCIP plan into the Affordable Care Act. The Affordable Care Act for me has meant saving a lot of money. My monthly policy has gone from $505 a month down to $136 a month. My out-of-pocket has gone from $9 grand to $2,500. However, I've made appointments with doctors only to have them call me back later and say, "Oh, we don't take your plan, we take other plans."
Just 2 months ago, it was all good. I had insurance, I was paying, it was reasonable, and now somebody made a change in this, and the geography changed, and I can't go downstate. I can't go to that hospital. I currently go to Albany, drive about 40 to 50 miles to go see my doctors.
Right now, nobody knows who's taking what, and there's not consistency across the board.
The organization, the plan that I had prior to ACA was still offered under ACA, but they changed it, they altered it. So it was the same insurance company and very similar coverage, but it didn't cover downstate anymore.
They said, "You're still the same insurance." I went, "Oh, no, as a matter of fact, I'm not, I'm now Medicare." And they went, "Geez, Lee, I don't know how to tell you this, but we don't accept it. We accept your insurance." I said, "Well, but it's secondary." And they said, "That doesn't matter."
It is kind of nerve-wracking to have to reestablish relationships and go through all the history, and you wonder whether or not the doctors really read your file. I really feel like a key part of all this is that you have a relationship, with your doctor and the team. And I said, is it possible if I had a recurrence, would I be able to go back to my doctor down in New York City? And the answer wasn't no. The answer was that I could get a quote-unquote hearing if that situation were to occur.
Unfortunately, this is kind of the times we're living in right now, that it's happening more often than not, where a medical plan may be inhibited or have numerous roadblocks because of insurance issues and coverage issues. They
had a good choice of plans, but the one plan that I really wanted, which was what I had, but a new version on the ACA, would mean that I could no longer go to the doctor that initially treated me.
I live in a remote area, and he is the only doctor in that area that does the type of surgery I'm going to need. And so what it's going to mean to me is I will probably need to travel to Los Angeles to have my surgery done here, which I'm willing to do. But I've had a history with him for many, many years.
It's hard to lose doctors. I mean, one of them I was a patient for 14 years. I mean, this was someone that I knew. I knew his family, I knew him.
The type of cancer I had, I've gotten a very good trust in the gentleman and all his nurses and stuff. And to change and have somebody else doing it, it's very upsetting.
I didn't have a choice. I had to find another doctor. It was wrenching. It was hard. It was disappointing. It was angering. It was not what I wished had happened, for sure.
I really feel like a key part of all this is that you have a relationship, with your doctor and the team.
When patients do get a serious illness like cancer, having the option for them to go out of network for a consultation and second opinion to reassure them that they are getting the best appropriate care, I think is something that ought to be built in, where that second opinion is not at a stratospheric out-of-network copay.
You can spend the time with the patient explaining why a treatment plan makes sense, but only to find out that this is going to take a little bit more work from an insurance perspective. In the meantime, the patient's disease remains untreated. So everybody's time is very important, especially the patient's time, actually.
It's perplexed me why insurers have not built those in to their Darrow Network products to have what I call a safety valve for people who are sick.
That to me is just not okay. It's just not okay. If we can't, if we can't care about our fellow man more than that, we got bigger problems to worry about.